As part of Bell Canada's ongoing effort to bring awareness to the importance of mental health, we decided to take a look at some of the costs involving mental health problems in the workplace. Now look at the average length of workplace leave in 3 different scenarios. The Centre for Addiction and Mental Health has this campaign to bring awareness to mental health. Have a listen.
You're imagining things.
What you really need is a girls' night out.
You're making a big deal out of nothing.
Honey, we all have bad days.
You're your own worst enemy.
It could be a lot worse.
It's just a phase.
Stop feeling sorry for yourself.
I don't get
Nothing
it.
a few beers won't fix, right?
Take the day off.
Crazy talk.
I know exactly.
Why don't you just stop
It's all in your
drinking?
head, man. Let's get over it.
That ad was part of the latest campaign for CAMH, which is the Center for Addiction and Mental Health, talking about how people deal with other people who are dealing with mental illness. Well, Dr. Carolyn Dewa joins me now. She is with CAMH as well, and she is the head of the Center for Research on Employment and Workplace Health, here to give us some more perspective. Thanks so much.
Thank you.
So tell me first off, that ad shows people basically telling other people to suck it up, deal with it. How do managers deal with employees that are dealing with mental illness?
Typically, I think when somebody has a mental illness, it doesn't happen overnight. It's not like the flu. So people have noticed changes in behavior over a period of time, and it's usually one of the most uncomfortable discussions to have. So people put it off until it gets to the point where we really need to talk. It would be good, I think, if managers began this talk early, so that we know that early intervention. So if we could encourage people to seek help and support if they need it, that they would be getting it sooner.
Is that a problem on the manager's standpoint because they don't want to, or is it because the employee doesn't want to tell them there's a problem?
I think it's both. I think employees are afraid sometimes to talk because of what are the repercussions of doing that.
Like what?
Well, if my company knows that I've had a mental illness, does that somehow endanger my chances for promotion? Or will people look at me strangely and not depend on me anymore, or consider me reliable? So there's that stigma piece of it too, that people sort of don't want to tell.
I know we're going to be talking more about how employees can deal with this, how people can deal with this, but if we look at it from a company perspective, there's some big numbers. I've heard that mental illness costs in productivity and output $51 billion a year, which is just a lot of money. I wondered if we could break it down, because I know in your research you've looked at, how long people can be off and what it costs. But for someone, let's say, who is off for a mental or behavioral disorder of some sort, how long on average are they off work for?
So on average, and it depends on the benefit plan that a company has, but usually about 60 days they'll be off. So
it's a long time.
They're usually off twice as long as somebody who went on for a physical condition, like a back injury or an injury.
Mm-hmm. And in terms of the cost, and I understand that I think it's $18,000 is what the cost to the company is for that person being off that long?
So that's just, it didn't even include what the replacement cost of having somebody do the work. That was just the benefits cost for the company. So actually, that's just the minimum cost to the company is $18,000.
What would that number probably more likely be then if it was fully costed?
Well, so then you have to figure out what's the burden to the other coworkers, because that work still needs to be done. What's the cost to the manager, who actually has to also maybe take some of that work on themselves? So you would have, does it include overtime, because people have to take on an additional job? So it's all those types of wages that it costs.
So for companies, I mean, it's worth their while to get involved earlier to deal with things, as opposed to later on when it becomes really costly. So you work with companies who are trying to do that. What are they doing to try and alleviate those costs?
So most of the companies, one of the things we know, that if you get treatment early, the disability will decrease, or the length of disability will decrease. So companies are really looking at how do we get those interventions to get people into treatment or get support early. So that's one of the things that the companies look at. We know that oftentimes people who have a mental illness and a disability due to the mental illness are at higher risk of having another disability episode. So they're looking at, so if somebody does have another episode, how do we make sure that we support them so that they don't have to go off work, or how do we make sure that they get treatment early?
Can you give me a practical example of what support looks like? I mean, what are the kinds of things that companies will do to make sure that their employees supported?
We're working on a project now which is very exciting. It's a peer support program. So this peer support program is a program where people get accredited to be supporters at work. And these supporters have been identified within the company. So if somebody has a problem, they want to talk to somebody who's a coworker or a colleague, they have somebody who they could talk to. It's totally confidential. It's also someone who has had an experience of a mental illness, so they can talk about their experiences, and it also gives people hope that, you know, the way I'm feeling right now doesn't mean I'm going to always feel this way, and I can actually get back to where I was before.
Let me ask you too, I mean, in this economy right now, I mean, you know, a lot of companies are just scared of spending in general, and we were kind of hearing things are pulling back. Are programs like this the first to go when something like this happens?
I think people look skeptically at these programs because oftentimes companies don't always invest in the evaluation of the company, but if they
evaluation of the program
of the program to see it works and what's the return on investment. So right now in the projects that we're working on, we're working with companies to show that return on investment.
And what's it been like? Any numbers you can share with us?
Well, so we found that for the return to work, and if you get early intervention, and the way the program was set up, you actually saved money and you got people back to work sooner. So it was a huge win for the company. And they wouldn't have known that if they hadn't actually looked at an evaluation.
Now, that was Dr. Carolyn Dua. She's head of the Centre for Research on Employment and Workplace Health at the Centre for Addiction and Mental Health. Let's drill deeper into this topic of mental health in the workplace. Our guest now, Dr. Katy Kamkar, clinical psychologist at the Work, Stress and Health Programme at CAMH. It's great to see you.
Thank you so much.
So 1 in 5 Canadians will suffer some kind of mental illness in their lifetime.
Absolutely. So it's really about 1 to 4, 1 to 5 Canadians who will suffer from a mental illness within a 1-year period. So no one is immune to mental health problems. It can affect anyone, regardless of occupation, income, culture. It can really happen to anyone. So no one is immune to mental health problems.
So you said in a 1-year period?
Within a 1-year period, absolutely.
1 in 5 Canadians will have some kind of a clinical problem.
At least 1 in 5 Canadians. I really believe that statistically, the number would actually even be higher. It's just because of the stigma attached to mental illness and people feeling embarrassed and ashamed, they're less likely to seek help.
Well, tell us how the workplace is central when you're trying to address this problem.
Well, we know that aside from home, the workplace is a primary location of the adult life. So work affects our mental health, and our mental health affects our work. So creating and promoting health in the workplace is essential for employees, for employers, and of course our community.
Stress, obviously, stress is arguably stuff that you haven't done, that's undone. But tell us the difference between acute and chronic stress.
That's a very good question, because acute stress is something that we all go through every day within our daily life and also within our job. And actually, a normal level of stress is normal and is adaptive. It helps us to be productive, to meet deadlines. Also, stress is important in situations where we perceive threat or danger. We all have this inbuilt alarm system, this fight and fight response that becomes activated when we see a threat or danger. So stress is very normal and adaptive in all these situations. It's really whenever stress becomes prolonged and overwhelming, so essentially when the stress becomes chronic, this is the one that interferes with our functioning and day-to-day life, and it creates psychological and medical problems.
And we're looking at how, obviously, you can get into a vicious circle here. You start neglecting stuff you're meant to be doing. You might turn to substances, and that just adds to the stress.
Exactly. And that's because of stress affects us cognitively, so it affects our thinking patterns, it affects us emotionally, physically, and also behaviorally. So as you mentioned, we might withdraw, we might engage in more substance use. Yes.
And this may seem like a very facile question, but apparently research shows that exercise, physical exercise has a dramatic effect on people's general outlook. Do you make a point of prescribing it for patients?
Yes, I do, absolutely. It has a very healthy component into it. In general, setting up a daily routine, daily structure is very healthy. And a part of that, assigning daily exercise, again, it doesn't have to be an hour, it doesn't have to be 2 hours, but sometimes even 20 minutes, even 10 minutes a day can really be very healthy.
You have some other advice on creating that boundary between the job and work. Can you go into that, please?
Yes, and that's really to help really to create a better, healthier balance between work and our personal life. So to really anything that could help to set up, making the boundaries a bit more clear. So it could be at times as realistic, it could be possible to reduce the number of times we would check the work emails at home. It could be leaving also work at a more decent time. And also making the transition much smoother between work and to home, like for example engaging in a relaxing activity when we arrive home. So all of those kind of activities can really help to set clear boundaries between work and our personal life, and also prioritizing. So really prioritizing our responsibilities, planning ahead, can really help towards feeling less overwhelmed and delegating responsibilities as much as we are able to.
What should employers be doing?
There are various things. Flexible work hours, flexible work conditions can be very helpful in terms of promoting a healthier balance between work and our personal life. Making the roles and responsibilities very clear. Whenever we are assigned high demands or responsibilities, if we have enough resources to cope with the demands, that can again contribute to significant health, and definitely supportive reintegration into work following a leave of absence.
Yeah, because that's going to be tricky. That's going to be horrendous coming back. Or
exactly.
Very, yeah.
And as we know, everything is about relationships. So really promoting healthier relationships, supportive work environment is essential.
It's got to be tough, though, for a lot of employees to seek help because there is a stigma.
Exactly. Employee assistance programs, or there are various other resources that organizations can offer. Employee assistance program, anger management programs, stress management programs. There are also community resources. It's very important not to suffer in silence and to seek help.
Thank you very much indeed for joining us, Dr. Kamkar.
Thank you very much.
Our guest has been Dr. Katy Kamkar, clinical psychologist at the Work, Stress and Health Program at the Centre for Addiction and Mental Health. A lot of good advice there.